The Issue TV show. Success. Truthful report.
Welcome on board. I am Valerie Alalade, anchoring for the Issues Online TV, the channel that reports it as it is. Just recently, the Porter College of Health Technology, Oru Ijebu, in Ijebu North Local Government Area of Ogun State, celebrated its 10th year of existence with educational activities, coupled with cultural display and award of honors to some deserving eminent Nigerians. It was no doubt a time to roll out the drum and celebrate the modest achievements of the health institution in the area of providing well-trained and certified manpower for the healthcare delivery in Nigeria and beyond. It is now so alarming that the exodus of medical and other categories of health professionals to advanced countries in search of greener pastures has brought significant disruptions to Nigeria's healthcare system. The 10th year one-week event activities started with Jumat service, followed by the free medical outreach service, the anniversary Thanksgiving, the interdepartmental games competition, known as Provost Cup Final. Damilola Ayepola has the report.
The Porter College of Health Technology, Oru Ijebu, in Ijebu North Local Government Area of Ogun State, celebrated its 10th year of existence with educative activities coupled with cultural display and award of honors to some deserving eminent Nigerians. It was no doubt a time to roll out the drums and celebrate the modest achievement of the health institution in the areas of providing well-trained and certified manpower for the healthcare delivery in Nigeria and beyond. It is now so alarming that the exodus of medical and other categories of health professionals to advanced countries in search of greener pastures has brought significant disruptions to Nigeria's healthcare system. The 10th year one-week event activity started with Jumat service, followed by the free medical outreach service, the anniversary Thanksgiving, the interdepartmental games competition known as the Provost Cup Final. The other programs featured during the celebration were the convocation lecture, the book launch, convocation ceremony, and capping the week-long program was the award and gala night ceremony where important personalities of the college were decorated with awards and certificates for their respective contributions to the growth of the college. Those that were honored includes Dr. E.O. Ononuga, the chairman governing board of the Porter College, Dr. Tunji Dawodu, former provost, College of Health Technology Ilese Ijebu, Dr. Samuel Adeshino Okweso, and Adetunji Nofisat, the lady who composed the school anthem, among other selected individuals. Delivering the 10th year anniversary lecture, Professor Mandung Barnabas, who doubles as a professor of pathology and chief medical director of Babcock University Teaching Hospital, Ilishan Remo, highlighted the roles of primary health centers across the country in making it possible for the rural dwellers to access qualitative health care. Professor Barnabas said the health scheme was based on the concept of PHC, and it was designed to cover most communities with essential health services, as this was the health plan that gave birth to the establishment of the Schools of Health Technology, which later became the Colleges of Health Technology, saying the aim was to train low and middle level health manpower to man the primary health care facilities. Speaking more on the present health status in the country, the speaker affirmed that Mortality rate for Nigerians between the year 1998 to 2019 decreased with large gains for children below the age of 5, those between 5 to 9 years, and women of reproductive age 15 to 30 years had a reduction of 40%. There appeared to be a reduction, but Nigeria still has the worst on the 5 mortality rates, both for males and females, behind Mali, Niger, and Burkina Faso. The implication is that government public health services have failed to address the 10-point agenda despite the creation of College of Health Technologies all over the country. The major drivers of this under 5 years mortality are still infection diseases, malnutrition, diarrhea disease, pneumonia, and tuberculosis. These infections remain the main drivers of mortality in Nigeria. And with these poor health indices, Nigeria as a country has failed to address basic health challenges bedeviling our communities. The highest death rate is located in our rural areas, where there is a dearth of functioning healthcare facilities.
However, Dr. Oluwaseyi Gabriel Adeware, the Provost of the Porter College of Health Technology, ORU, is one Nigerian that has vowed to help fill the yawning gap created by the challenge of brain drain. The Provost of the college, Dr. Adeware, in his message on the essence of establishing the health college a decade ago, disclosed that people have started seeing what we are doing and they have started picking interest. Now, our college has been accredited by all relevant regulatory boards, councils. The way it is run is different from the way the university education is run. Adeware further revealed that he was quite satisfied that the Porter College of Health Technology, ORU, has in the last 10 years continued to blossom with all its academic programs, while many of its graduates have continued to make waves in the country's healthcare services and abroad.
What prompted me to start this vision 10 years ago was basically the fact that I'd always loved to give back to the society and to impact young people. So 10 years ago, the urge was so much, and it came to reality that I now felt I needed to start something to give back to the society. Education sector in Nigeria is actually a work in progress. We are not there yet, but we are not doing that bad. Because if you look at the fact that our students trained in Nigeria can now travel abroad and they can be employed, it shows that we are really doing well in Nigeria. The only issue is that the policies, our policy makers need to come to the community and involve with stakeholders in planning some policy, because there are a lot of policy somersaults when it comes to education sector. So once the politician can engage stakeholders and they can really get to know what's really happening in this community, I think that will resolve this issue of policy issue. But when it comes to training, our training is qualitative. Take, for instance, in the Porter College of Health Technology, we are accredited by about 7 bodies, professional bodies who regulate our programs, and at the end of the training, they are the ones who come and examine our students before they can get a license to practice in the country. So, and if you look at the process of them coming to do accreditation, it is really an equivalent tax. There's no shortcut. You have to get the equipment ready. The laboratory has to be intact. The library has to be stocked and packed with recent books and journals. So when you look at this process of getting accreditation, you come to a conclusion that our education system is just perfect. There has to be incentives for health workers. There have to be better package that will make them stay. They can't travel to UK or to Saudi Arabia where they get a better pay, and you expect them to stay in Nigeria. And going by the rigorous training they have gone through, even at the middle level that we do here, we know the kind of training these students have been subjected to. So at the end of their training, they expect that they should have a proper welfare. So once this is missing, this might affect and make them want to migrate to for greener pastures.
The Porter College of Health Technology is a fast-growing institution. In all ramifications, the institution is growing to my satisfaction. Resource-wise, the school is growing. Look at infrastructural facilities, is growing so tremendously. Look at curricular material, wonderful. Look at accreditation of the programs. Today we are hearing about institutions running programs not being accredited, which is even against the law. Almost institution in Nigeria is running foul of it. But in this institution, the Porter College of Education, because I've been part of accreditation in this institution, all their programs are accredited by the appropriate bodies. And that is a wonderful one.
The Porter College of Health Technology, we don't discriminate. We accept all tribes, both Yoruba, Igbo, Hausa. In as much you are willing to learn and you want to impact your society, we don't discriminate in religion. We accept Muslim, Christians. These are the two religions we practice here. We have fellowship for our Christian students, and we have mosques, which is built in the college for our Muslim students, where they can go to every Friday to have their Jumat service.
Train students to be great medical practitioners, thereby bridging the gap of our health care delivery system. We work with standard. The Provost himself don't tolerate anything below standard. Same thing goes with all the staff, and the student also knows it.
The environment is very welcoming, and the environment is also very, very conducive, very, very, very conducive for learning.